Okay, we will go ahead and get started here. My name is Dr. Terry Winfrey. I am the Executive Director of the Chicago Southland Chamber of Commerce, and we are always here to advocate for you and to help educate you. And today we have a wonderful opportunity with a great panel here that's going to give you some great information about vaccinations and who is vaccinated, who's waiting to be vaccinated, and answer some of your questions. This particular panel is sponsored by our Healthcare Council. So those of you that are chamber members and those that are not, you should know that we have different councils, different committees, and each committee has their opportunity to work on different projects. And so this panel is this committee is co-chaired by Paul Donahue with Ingalls Development Foundation, who's here with us today. And he is going to facilitate this panel today, and I will let him begin by introducing our distinguished panelists. Paul?
Thank you, Terry. I appreciate it. I appreciate being with everybody on the call today, on the webinar. As Terry mentioned, we feel like this is a very timely topic, a topic of great interest to the business community in particular. Just talking about the vaccination, the challenge that we have in getting folks vaccinated, especially those essential workers that are so important to keeping our economy strong. So as Terry mentioned, we have a terrific group of panelists today to have the discussion. We would like it to be interactive, and so please take advantage of the chat function and put some questions in there, and Terry will help facilitate the questioning. First, we have the CEO, Chief Executive Officer of Nuance Solutions, Jim Flanagan. He is a leading innovative manufacturing company of specialty and maintenance chemicals. It's headquartered in Chicago. The company was founded in 1972 by Jim's father, John. Jim has served as president, now CEO, since his father's death back in 1990. And since its founding, Jim has served in various capacities in operations, finance, marketing, and sales. We look forward to hearing from Jim shortly. Also delighted to have a colleague of mine, Randy Manns, works as a service line specialist at UChicago Medicine in our occupational health division. And Randy is a frontline professional in helping to facilitate the communication, the logistics, and the vaccination of frontline staff within the business, the manufacturing sector. Randy's a certified paramedic, 30 plus years of experience in the private ambulance transportation industry, highlighting his leadership in EMS, administration, field supervision, and operations. Randy's also a fire chief for the fire protection district in the south suburbs. And so Randy brings tremendous knowledge, experience, and expertise to the conversation. Randy, thank you for being here. Finally, we're also delighted to have one of our physicians in the Southland area, Dr. Yolanda Rosales. She's a fellow with the American Academy of Pediatrics, works at ABC Pediatrics. She's in fact the chief operating officer, practicing since 2001. Her residency was at the Children's Hospital of Illinois, University of Illinois at Peoria. She will bring a medical perspective to the conversation. Delighted to have Dr. Rosales with us today. So to begin the discussion, we thought we'd start off with Mr. Flanagan. And just give us, Jim, your perspective, your story as it relates to getting your staff vaccinated. I don't even know if they have been or not. So why don't you start off with a little bit of background and discussion regarding your experience at Nuance. Mr. Flanagan?
Sure, thank you. Well, as you said, our company's in the maintenance chemical business. So a year ago, we were faced with the daunting task of making as much disinfectant cleaner as much as possible. We went from one shift to two shifts, went from an 8-hour day to a 20-hour day, endured all the different COVID related disruptions in business as we all found that first 2 or 3 months when nobody knew what was going to happen. COVID was very good to our company, by the way. unprecedented sales, especially in that, healthcare disinfectant area. But, we had a lot of people on top of each other, sometimes 100 people working in our plant, working in different capacities, filling lines, batching, things like that. So needless to say, we were very anxious to get our workforce vaccinated as soon as it was possible. And our story really starts with me. I got a text message from somebody on a Saturday, I think it was January 30th, saying that ASCO has opened up their vaccination website. So I got on the ASCO website and I got myself a vaccination appointment for February 6th as an essential worker. And didn't do anything more than just get my vaccination to see if it was real. I showed up there hoping that it was real, and it was. It was very well run, by the way. So I went back to the office that next day, or that following Monday, and said, we've got to get people on this ASCO website. So we sent out a survey. You want to share that survey? Can somebody share that survey? Or do you want me to just read it off?
Why don't you go ahead and read it, Jim? And if we have access,
Yeah.
we'll go ahead and.
So we just sent out
it.
a survey to all our employees that asked really 5 questions. One, would you like Nuance Solutions to help me book a COVID-19 vaccine? Yes or no? Or one of the other questions was check off, I have not decided if I want to get the vaccine. The third question that you could check off was, I have already received or scheduled my own vaccine. The other one was, I plan to get a COVID vaccine without the assistance of Nuance. And the fifth one was, I do not plan to get a COVID vaccine, period. We got all our surveys back within a few days. We hounded people for it. And as you might guess, just like nationwide, about 75% of our people said yes. And the other 25% said, I'm not sure or absolutely not. We went back to the 25% and asked them again. Some shared it with us why they were hesitant. Some people just wanted to wait. Some people are just not going to get it. So then we also asked for the basic information, their cell phone number, which you need on most of the websites. You need obviously an email address. We didn't have all our employees' email addresses other than their work ones. So we had to get those. We had to get some home addresses. So we compiled all this, put it on a Microsoft Teams spreadsheet, and populated that spreadsheet to get ready for us to get on the internet on that Friday, which would have been like the I think the 12th of the 12th of February. And myself and 3 other people started on Friday night, and we just were relentless getting on and off that website. And at the end of the weekend, we had 54 people registered. And we were absolutely thrilled. Friday night, I personally got 32 people registered. I was cross-eyed at 2:00 in the morning getting them registered, but nobody was doing it at 2:00 in the morning. So we were really happy about that, which left about another 20 people that we needed to get registered, which the following weekend, because ASCO opened up on weekends, we got a few more people. And then lo and behold, on the 2nd of March, we had about 15 people left we needed to get registered. And we got a surprise email from the Chicago Department of Health that we had signed up about a month earlier on just registering, and then they'll let us know when there's vaccinations. They sent us an email on the Monday, the 12th, on the 2nd of March, saying that at 2 o'clock on the 4th, you can send as many people over to Olive Harvey, which is across the street from us, and get them vaccinated. We got our remaining 15 people vaccinated there. And basically, so by the 4th of March, or less than a month later, we had everyone who wanted a vaccination, over 80 people, vaccinated at least once. So that's our story.
Jim, that's fantastic. Thank God the employees at Nuance have you as a CEO for that type of personal effort to take care of your employees. That's a fantastic story. Congratulations to you and the work that you've done.
Thanks. Well, it wasn't just me; it was a number of people, but it was in everyone's best interest. I mean, we're still super busy, and we were really pleased with the participation and the willingness of people getting vaccinated. So we kind of have our own little mini herd immunity at our company, it takes a lot of weight off everybody's shoulders knowing that.
Nice. Again, congratulations. Thank you for sharing your story, and please stay with us as we continue the discussion and hopefully get some questions. Nice opportunity to transition to Randy Mans. And Randy, you heard Jim's story, and a lot of companies are taking their own initiative, obviously, to try to take care of their essential staff, but you are on the front lines directly in providing support to employers to find vaccination opportunities for their employees. So if you could just kind of take the story from there, Randy, and give us a sense as to what you're seeing in the business community as it relates to the demand for vaccines, and how you and others in the occupation medicine field are providing that assistance that's needed. Randy?
Thank you, Paul and Jim. Great story. I've heard that story echoed probably 100 times in the last month. Everybody just trying to find the vaccines and how can we get the vaccines, and your due diligence and just sticking on a computer and taking care of your company is phenomenal. I mean, it just speaks to obviously the company that your father started and you're continuing. I mean, that's great. Kind of have a success story like that right in our backyard in Harvey. We just did a on-site vaccination clinic for a very large company in Harvey. We did that last week, actually. We had 300 people sign up. We vaccinated 287 in 6 hours. It was our first on-site vaccination clinic that we set up through Chicago Medicine, Ingalls Occupational Medicine, and it was a huge success. But we've had a lot of trials and tribulations also, because we can set up these pods, they're called, point of distributions. But the hardest thing with that is we can set it up and say, hey, we'll come to you, we'll set this up and we'll vaccinate 1,000 people. But it isn't until the Friday or even Sunday before the vaccination clinic is set up that we are notified on how many vaccines we're getting. So we may set up for 1,000 and they could tell us, well, we're giving you 200. So we feel that exact same pain. We're trying to bring this service line into the city of Chicago. We've had some very big corporations get a hold of us and want us to come on site. And the battle to try to get vaccines within the city of Chicago is certainly a story all amongst itself, and we won't need to get into that. But the challenges are for everybody. They're for the grandma and grandpa that are sitting at home trying to get the vaccines, to corporations with 55,000 people in it. We're fortunate. We're actually starting next week. We're doing vaccination clinic for 3 of the large unions in the area at the Mokina Union Hall and another union hall in Alsip, and then also for another smaller union in Alsip. So this is kind of really unprecedented, and this kind of speaks to where we're at in today's day and age. I've had 3 different unions, the electricians, the pipe fitters, and the laborers, all coming together hand in hand to say, you know what, we don't care if an electrician walks into the laborer's hall or the laborer walks into an electrician hall. We just want to take care of our employees, our workers, and try to get back to normal, which is just phenomenal. I think everybody knows that unions are very close knit, tight knit. They kind of like firemen. We kind of stick to ourselves, and to see this happen is just amazing, and it really speaks to where we're at in the world today. So with that, I'm just going to go ahead and present a PowerPoint presentation. And we'll go ahead and we'll just talk a little bit to this. Of course, we need to have the legal statement for everybody. As everybody knows, well, this slide was done prior to yesterday at 8 o'clock in the morning. So there are 3 typical vaccines out there right now: the Pfizer, the Moderna, and then the Johnson & Johnson. However, if you've been watching any news in the last 24 hours, the CDC, IDPH, everybody has pretty much put a halt on the Johnson & Johnson vaccine for us to be able to use that. And I'm pretty positive the doctor's probably going to speak to that a little bit. So I'm not going to get into that a whole lot because her level on that is probably way higher than mine. But just to know there was 3, we're down to 2 right now. To speak to that though, so we had 3, now we're down to 2. So what are we doing about supply now? I mean, that's a big worry. There was a lot of people that were set up to receive Johnson & Johnson's vaccines to give out next week. So once again, we're right back to that circle that I spoke of earlier. It's like, are we going to get the vaccines that we need to get the shots in the arms? And that is yet to be seen. Just a little breakdown of the different vaccines. And I do have this slide show. I'd be more than happy to share. I'm sure the doctor may get a little bit more into specifics of exactly which vaccine does. And then the comparisons, which I think are pretty interesting to look at. I'll just give you a minute to look over those. And certainly if there's any questions, you can certainly throw it up to the panel. This is one big thing when it comes to organizations like ourselves and people that are having, on-site clinics. This right here is pretty big. The Pfizer really has some very, very strict rules and regulations as to how to store it. And for us, we're really requesting just the Modernas because the Pfizer is very difficult logistically when we're going out on site to these companies to give it. So just so you know, that is definitely one of our challenges. All right, so University of Chicago Medicine, Ingalls Memorial Hospital in the Med department, we have a couple different options to getting people vaccinated. We have 2 options for smaller companies with less than 300 employees to be vaccinated, and then large companies that have over 300 people to be vaccinated. For small companies, and actually I have something to add to this slide that I just found out last night. Vaccinations will be given at the Ingalls Occupational Medicine building in Tinley Park, working with U Chicago Medicine, Ingalls Hospital Occupational Medicine to schedule a closed pod for those employees to be vaccinated. So what this kind of looks like is if I have 5 companies that all have say 20 people that need to be vaccinated. We could go ahead and put those 5 people together in one pod, which is appointed distribution, and say, okay, on Thursday, August 3rd, all 100 of you can schedule, give you a website. You just click on it, you schedule your times, you come into Tinley Park and get vaccinated, which is really exciting. But actually, what I just found out last night, we're teaming up with our occupational medicine telemed doctors, Emerge Medical Staffing, to kind of flow some of our people into his pop-up vaccination clinics that he has. Right now he's operating Monday through Thursday in Hazel Crest. So I have links to that. If people are interested in that, I certainly will be able to share that with you. And this is for the Chicago Southland. This is a benefit to becoming a member of the chamber, because not everybody knows about this site. Not everybody knows that this site is popping up. I know the doctor's going to be talking to different areas and where you can find a vaccine, but this is something that we're offering. U Chicago Medicine, Ingalls Occupational Medicine, along with Emerge Medical Staffing, to get your people vaccinated, to get the workforce vaccinated. And then our other option is for large companies. And this is what we're currently doing with the unions and a couple other companies. We set up a pod right there at your location. Your people sign up for the day that we're there. They go on the website. It's very, once you get into the website and you find someplace to get a vaccine, it's pretty seamless. I mean, you type in your information, you get a little QVC card that bring in, and we scan you through each step of the process, and we can do that right on site at your facility. And the price for that would obviously depend on how many people we need there. And if you're interested in that, certainly reach out to me, and I'll be more than happy to talk over some options that we have for you. And then my last part would just be any questions and answers, and we're going to be doing that at the end. So thank you, Paul, very much for this opportunity. I hope that some of the information that I've shared has helped you and kind of enlightened everybody. And if you have any questions, please feel free to reach out to me directly. I'm sure my contact information is listed along with this webinar that we're doing. And everybody have a great day. And thank you for this opportunity.
Thank you, Randy. We appreciate your remarks on the front lines of helping to administer a vaccine program for businesses, employers, folks that would have an interest or questions about that. Feel free to reach out directly to Randy or ask questions during this webinar. So thank you. If you could stick around, Randy, as we continue the dialogue, I'd like to at this time introduce Dr. Rosales, who is board certified in pediatrics for a medical perspective on workplace vaccinations. Dr. Rosales, thank you for joining us. Just an initial question, what can you share with us in terms of an update on the vaccines that are out there and any information related to the Johnson & Johnson announcement, or just what's your perspective on the vaccines that are currently being utilized in the marketplace?
Yes, thank you for having me. Absolutely, I will definitely address that. Thank you, Jim. I love hearing your story. As a pediatrician and especially as a small business owner myself, I just love hearing your passion to keep your employees safe and moving forward, engaging them in vaccine appointments. As they mentioned, I'm a pediatrician in Northwest Indiana. Obviously, I'm very passionate about vaccines. And honestly, since December 18th, when I was vaccinated, I've been talking vaccination to all my parents because at that point, I can't vaccinate my patients unless you're 16, which I'll get to. So I love discussing the vaccine over the weekends as well. Since February, part of Chicago Plus, Protect Chicago Plus program, I did help vaccinate about 800 patients on a weekend, just as a volunteer basis. Again, I'm so passionate about this vaccine and I love talking about it. So thank you everybody for having me here. And I was even able to vaccinate the Easter Bunny for Easter. So just wanted to throw that one out there. Okay, the next slide. Okay, so obviously, like, why do we want to get vaccinated? Why do we keep talking about this? Why is this important? I'm going to hit a little bit on the science and definitely discuss the elephant in the room about Johnson and Johnson. I'll go over vaccine safety, definitely answer any frequently asked questions in regards to the vaccine, briefly review the vaccine trials, discuss how our current vaccines will deal with variants, and sort of discuss what are our next steps. Okay, so why should anybody consider getting the actual vaccine? First and foremost, this is going to be our ticket to ending this pandemic. Oh, can we go back one? It will definitely protect you. So if you get the vaccine, it's going to protect you 100% from getting either severe COVID, which means intubated in the ICU, or experience COVID death. Also, I'm sorry, one back again. And so basically, if I hear a lot of people say, well, I don't have, risk factors. I'm young. Have a healthy body mass index. I don't have asthma. I don't have diabetes. So I'm not really worried about COVID. And that's really not a good sort of mentality to have. The truth is, we're still learning about COVID-19 infection and sort of what it does after you've received it. So the actual infection. So for instance, you might be a 20-year-old who's healthy. You may not end up in the intensive care unit if you have COVID, but it's the after phase that we still don't really know. So me personally, as a pediatrician with my patients, all last year, yes, I was able to, tell everybody, luckily COVID isn't sending our pediatric population into the intensive care unit. It might just present as a cold, as a sore throat. But now that we're a year later and kids are trying to get into sports, it's very important that we really hone in and say, did you ever have COVID? Did you ever test positive for COVID? Did you ever have symptoms? Because we really have to pay attention to your heart. We might need to send you to a pediatric cardiologist. We might have to do sort of cardiac testing on you. So for all these reasons, it's important for all of us to get vaccinated, to maintain health, to be around your family and your friends again. If you can congregate indoors, if everybody is vaccinated. And then again, as I said, this is our only ticket to end this pandemic. Next slide. Okay, so obviously we have 3 vaccines: Pfizer, Moderna, and Johnson & Johnson. Johnson & Johnson is outlined in red because it currently is on a pause. The FDA and the Advisory Committee on Immunization Practices has put a pause on Johnson & Johnson. Actually, they are meeting right now discussing sort of further steps. Basically, there has been 7 million doses administered, and 6 women between the ages of 18 and 48 developed symptoms 2 to 3 weeks after the vaccine, where they ended up having a blood clot in their brain space and their platelets were low. The medical term for that is cerebral venous sinus thrombosis. And so obviously it's, less than 1 in a million or 1 in a million chance of this happening. I'm very proud of the ACIP and not surprised actually that they say, all right, let's pause, let's regroup and see if we can move forward. And I think all the experts at this point truly are calling it a pause. And again, as a pediatrician, I've been vaccinating for 20 years in all different types of vaccines. My personal experience with this is it has happened one other time. About 20 years ago, we had rotavirus vaccine come out, which helps protect against stomach flu. And at that time, the same thing happened where the advisory committee noticed they're constantly monitoring the country to see if there's any link with any vaccine. So it's not just COVID, it's any and all vaccines that our kids typically get to go to school. And they're always constantly observing to see if there's any sort of pattern as far as hospitalization rates or any new development in symptoms. And so anyway, the specific story is 20 years ago, there was a rotavirus vaccine. There was a little bit of an alarm with children being admitted to the hospital and having sort of stomach ailments and possibly requiring surgery. So they did put a pause on the vaccine and did the same thing, paused, evaluated to see, do we need to change the vaccine? What do we need to do to move forward? And after that, then yes, the vaccine was deemed safe and we've continued. So honestly, I'm personally not surprised or shocked or scared that they've done this. This is just typical for overabundance of caution. And in the end, it should give everybody that extra confidence to say, I'm getting vaccinated. I know this is safe because I know the ACIP, the FDA really go out of their way to make sure that things are moving as they should with vaccination. As I tell all my parents, it's not like once it gets approved, everybody just goes home and falls asleep. It's a constant observation, even for the vaccines that have been around forever. The hepatitis B's, everything that your kids have gotten or that you've gotten when you were a child or adolescent. Next slide. Okay, so how does all this work, right? I'm sure everyone's been hearing different terminology, mRNA, DNA, what is all this stuff? So basically, it's very exciting. I love talking about this stuff, but the little picture on the, I think it's on your left side, the little spike there, the idea is that the mRNA vaccine, which is Pfizer and Moderna, have sort of, it's an instruction manual on how to make that little protein or that little spike. So the vaccine goes into your body, that instruction manual tells your body, okay, make this little protein. That protein is basically the outer part of the COVID virus. And that's how the virus actually enters your body and causes havoc and causes you illness. So what happens is this specific instruction manual tells your body, make just the outside part of this protein. It's not the virus. And then once that protein is floating around in your body, your immune system says, aha, this does not belong here. Let me mount an immune response. I'm going to make antibodies. I'm going to make T cells and B cells, which is part of our immune system to produce long-term memory for that virus. And then once that occurs, the actual instruction manual, which is the mRNA, just kind of dissolves and goes away. It does not cause COVID. It is not COVID. It will not convert into COVID. It is technically just the instructions on how to make the outside piece of the coronavirus. As far as this is the first time we're all hearing it, or general population has been hearing about mRNA, so everybody thinks it's brand new. The truth of the matter is it is not. It has been in research for the Zika virus, for cancers, and for influenza. It is made rather quickly, so that's one of the reasons why we were able to, they were the first two to hit the market. mRNA viruses, vaccines work very fast. And, just to reiterate again, like there was no steps that were skipped by the FDA. Everything went through the normal process. And then the last thing, again, it just cannot give you COVID. It's not going to give you COVID. It's not going to convert into COVID. You can't get sick from COVID with the vaccine. Okay, and then Johnson & Johnson, which obviously currently is paused, but we still will talk about it because it is a good vaccine. As the previous speaker mentioned, the other two are a little bit more challenging to keep storage. Pfizer in particular, Moderna can be in regular refrigeration. The benefit to Johnson & Johnson is that it is just a one-dose vaccine. And so as we've seen with the city rolling out like homebound programs and stuff, there's just some patients that there's no way for them to get 2 doses. So this is a very good vaccine. The way it works is basically adenovirus is another type of virus that exists in the world. It causes the common cold. They use that, but it's a weakened adenovirus. It's not live. And that's the way how the vaccine enters your body. And it's just the same idea as the other vaccines. It's an instruction manual on how to make the coronavirus protein so that your immune system knows what to do. It produces antibodies, it produces T cells, it produces B cells. It's just happens to be like one step before the mRNA. So it's a DNA vaccine. What other things? So, and again, it's past every step, FDA step as the other 2 vaccines. This takes a little bit longer. So that's why it came out a little bit later than that. And then it's definitely not new. Like I said, influenza is a typical vaccine that we give that's part of adenovirus. And as the slide is showing, there's an Ebola vaccine as well. And AstraZeneca is along the same lines. And again, it cannot absolutely cause you to, it's not going to give you COVID-19. It's just teaching your immune system, this is what COVID-19 looks like, be prepared. Next slide. Okay, so discussing this again, basically, like I was saying, 7 million doses were administered. Only 6 women developed this. It was very important that they took a pause because they want to make sure, they want to be confident in what they're giving. This recommendation and this pause of Johnson & Johnson by no means says that we need to pause on Pfizer and Moderna. Both of those vaccines, we have administered 180 million doses, and there have been 0 reports to date. So with this pause, it's a good thing that it's happening because we want to move forward confidently, but it definitely doesn't cross-react to the other vaccines whatsoever. And like I said, the ACIP currently is on a call, and it was actually a public call, so anybody could log in to listen to their meeting. Next slide. Okay, so yeah, basically, you know, the FDA has to go through multiple steps to make sure things are proper. You can read that. Next slide. And then, I guess, sorry, one thing I can mention, I mean, everybody keeps asking, why is it, you know, it was so fast. I don't think I can trust it. I don't want to do that. I'll wait another year. I'll wait 2 years. I want this to be around for a little while. What makes the difference between these vaccines and all the vaccines that I give in my office normally, like this was a pandemic and the government definitely dedicated a lot of money to the research in this vaccine. So all the typical hurdles that vaccination companies would have to go through basically were 100% eliminated because the funding was there. And as we all know, if you have money, you're able to accomplish the things that you can. So that's one of the main reasons why everything moves so fast. But from a safety standpoint, like I said, the vaccine is effective, and they're still studying it. You know, we were the first ones to get it back in December. They're still studying it. They're still going to continue to observe. So we should all move with confidence with this vaccine and not allow the fact that it was created in a very timely manner. I mean, thanks to science, they were able to create this in a timely manner, and this really is our ticket to end this pandemic. Okay, and then the side effects, you know, this is gonna definitely, there's a wide range of side effects. There's some people, and I'm sure everyone knows somebody who's had the vaccine, so I'm sure that you guys already know personal stories, but you know, it can vary. You can have 0 side effects where it's like, oh, my arm hurt a little bit, to, yes, I do have fever, I have a headache, I have muscle aches, I have fever. That's all completely normal and expected. That basically just means your immune system is working. So that's nothing to be cause for alarm. All the people that I vaccinated, you know, they would always ask me, like, should I take Tylenol? So the question is, like, or the answer is, like, we don't want you to take medicine just to take it. So we don't want you to wake up the morning of your vaccination and appointment and say, all right, I'm going to take my Tylenol and moving forward. Like, we want you to wait to see if you actually have a reaction, because it can very minimally interfere with just how your immune system is building to the reacts to the vaccine. So we basically just say, like, just wait it out, see how bad it is. If it is bad, then whatever your doctor typically tells you to take, if they say to take Tylenol, which is acetaminophen, or ibuprofen, either is fine for it. We do, for, again, overabundance of caution, automatically everybody has to wait 15 minutes after the vaccine. I think that was very wise of the companies to make that recommendation. And honestly, from all the weekends that I was vaccinating, all the people that I witnessed, and, you know, I vaccinated personally, were sitting there for 15 minutes, like, there was 0 reactions. I never once had to pull out the EpiPen. I never once had to call 911. I didn't have anybody faint. So I'm glad they're doing it, and they will continue to do that. But you should, and from my personal experience of, like, all those weekends from February 14th through Easter weekend, we didn't have any reactions. Every vaccine site will have an epinephrine pen on site. There is a questionnaire when you do fill out your vaccine, for your vaccine, and it specifically will ask, like, are you specifically allergic to 2 components of the vaccine? One of them is a typical component that you would see either in Miralax, which is a medicine that you take for constipation, or if you've had a colonoscopy, like for a colon prep, if you've ever taken that and have had a severe reaction, then that's something that you need to mention, and mention to your own physician, because they likely would then recommend an EpiPen or, you know, further recommendation for that. And another medicine or ingredient, excuse me, can be found in, like, eye drops called dry eyes. But typically we say, like, if you read the names and it doesn't make sense to you, you've never heard of it, then you're likely not allergic to it. And then it will specifically ask, like, do you have severe allergies to food, to other medications? And if the answer is yes, then basically we will observe you a little bit more, like more than 15 minutes, more to 30. Next slide. Oh, sorry. And then the last thing I do want to take with the Johnson & Johnson. So basically what everyone is saying now is if you've received the Johnson & Johnson vaccine, basically at the 2 to 3 week mark, we just want you to be cautious and pay attention. If you do develop a severe headache, severe abdominal pain, severe leg pain, then of course we want you to seek medical care. Either contact your healthcare provider or go to the nearest emergency room. Okay, and then okay, then everybody, like who is available for COVID-19 vaccine? We basically everybody. If you have a pulse, you're alive, you should get the COVID-19 vaccine. Of course, the intake sheet will ask, are you pregnant? Are you breastfeeding? But that's just for us to know. We still recommend it if you're pregnant. We still recommend it if you're breastfeeding. Right now, the limitation is 16 and up. So I'm really excited that Indiana has opened this up to 16. Illinois has opened it up to 16 and up. They specifically have to get Pfizer, other 16 and 17-year-olds. Otherwise, 18 and up, it's Moderna or Johnson & Johnson once the pause, once it gets released again. What are the things? And just real quick on that too, as a pediatrician, I'm super excited. I'm hanging on, crossing my fingers every day, waiting for the next round to come out of saying, okay, now I know Moderna and Pfizer have submitted for authorization for 12 and up. So that's going to be a huge game changer for our kids. If they can get vaccinated this summer, then wow, they might have a chance of a real fall in school, maybe sports, kind of a little more resemblance of what normalcy is. And there are current studies occurring for 6-month-old to 12 years old, sorry. So eventually this is going to be like the flu vaccine. Right now, the flu vaccine is recommended if you're 6 months to 100 years old. That's what the recommendation is. I think eventually that's where they want to go with the COVID-19 vaccines. And then it is free to everybody. When you do go to your COVID vaccine appointment, they will ask for an insurance card. If you don't have insurance, don't worry, there is no out-of-pocket cost. If you do have insurance, don't worry, you're not going to get a bill. They will submit the administration fee to your insurance company, but in the end, doesn't matter what your deductible is, you are not going to get a bill for that. Next slide. I think I touched upon this real quick, but yes, if you're pregnant, postpartum, breastfeeding, like everybody should get it. The ACOG, which is American College of Obstetrics and Gynecology, did make a statement saying, obviously it's better if you're vaccinated than actually getting COVID. If you're pregnant and you get COVID, the disease, you can end up in the intensive care unit. It could be extremely bad for you and for your baby. So again, obviously pregnant women can reach out to their doctor and get their opinion on it, but in general, it's recommended. Next slide. Just a quick slide on just, documenting different groups that were part of the vaccine trials. So you can see the numbers there. I won't bore you by reading them out loud. Next slide. And what is the complication? So basically they're just trying to say, like, obviously people with high risk did receive the vaccine, and they're just breaking it down there who was a high risk condition and people who didn't have high risk conditions that were in the trial as well.
Doctor, can we squeeze in a couple questions?
Sure.
How much further on your presentation? I don't want to cut it short.
I think we're almost to the end, but I'm not running the slides.
Well, first, amazing information and presentation. I don't know of any resource today that is more timely as it relates to the Johnson & Johnson information than what you just provided for our chamber members. So thank you. A wonderful presentation and great insight. And again, it just speaks to the value of this relationship that we have in the chamber with our members to provide access to these experts that live within our community and serve and support our workers, our employees, and businesses. So thank you, Dr. Rosales. Just a terrific presentation. I know, Terry, that there were some questions coming in. Do you want to go ahead and read off a couple of those in our last 15 minutes or so with the panel?
Sure. There were some that we got in advance, and I think probably, well, anybody can answer them, but I think Dr. Rosales is probably most prepared for these, and it's it actually came from one of our members, the Thunderbolts, which is a baseball team. And so they have seasonal employees. So the first question was, can a seasonal employee whose primary residence is outside of Illinois be vaccinated in Illinois?
So great question. At the end, we're going to put in the link, all the different vaccination states. And from what I've seen, I mean, now that obviously it has been very, very challenging and difficult for everybody to get the vaccine, but now I see that the big chain stores are opening this up. So now you can get a COVID vaccine at Costco, CVS, Mariano's, Walgreens. So I don't believe that they are making residency a restriction. Like I do believe they say if you work or live in the state. And then I think the second question was, if you get your first dose here in Illinois, can you get it somewhere else? And I believe, I mean, obviously I can't speak for every state, but I know specifically for Illinois, a lot of times when you go register, it specifically will ask, is this your first dose or is this your second dose? So it seems like the theme is there, everybody's already used to, you might have gotten your first dose somewhere else and you're just coming to us for your second dose. So I don't believe that that's going to be a challenge. Okay.
Okay, and I think because that's, I think of students, students that are from out of state. I think of, the snowbirds that spent a few months in out of state might have wanted to have their first vaccine and then are waiting. So that's good to know if they have those options. Okay, and then there's another question here that I have also, and I think this would be for you, Jim, Jim Flanagan. How do the employees feel? Okay, so how do the employees feel working with those who did not want to get vaccinated? Yeah. So yeah, how safe, how comfortable, how uncomfortable, what's the climate there?
Well, the ones who had the vaccine really don't care because they're not going to get sick. And if they do get sick,
okay,
they're not going to go in the hospital. So it's really people that choose not to, they're potentially putting themselves at risk. But if they don't believe in it and for whatever reason they want to wait, we weren't going to force anybody to do it. But fortunately we had 75% of our people get it. So that's the best answer I have. I mean, that's what I've heard.
No, and that's a great answer. And really kudos to you because you went above and beyond. You weren't just encouraging them, you were helping them and making that a priority. So that's hugely important. So let me just ask this question in a different way. And Dr. Rosales, maybe, so if a person has been vaccinated, can they not be a carrier? I mean, like, so if I've been vaccinated, I've had both vaccinations, but does that mean that I could not still be a carrier and give something to someone who has?
Right. So that's a great question. And I don't believe CDC has completely come out with the recommendations. That's why they still recommend if you've been vaccinated, you still have to wear a mask because that's still kind of an unknown territory. But it's, basically the recent thing is if you're vaccinated and you're going to see your grandkids, they're obviously not vaccinated, you're protected. The only problem is you might be giving it to the grandkids. So that's why everyone's saying you have to make sure, your grandkids aren't suffering immunosuppression or whatever. So it's probably less likely than if you didn't. But right now, because we're still in the thick of the pandemic, it's still recommended to wear the mask, social distance, and constant washing your hands.
Okay, thank you. There's another question then also that is from Dr. Roberson from Governor State University. I'm working with a large community organization that is partnered with Chicago State University for a big Johnson & Johnson vaccine push. Now that this has been paused, how can or what strategies do you recommend community advocates to use to encourage community residents to get the J&J vaccine once they resume its use?
So I'm sure, obviously, Chicago, Department of Public Health will definitely have guidance on all this. I mean, they, Dr. Arwady yesterday on She does a Facebook Live every Tuesday and Thursday, which I strongly recommend everybody to do. She's an excellent, obviously she just knows what she's talking about. She's got excellent information. And it's disheartening right now, honestly, because even yesterday, there were a lot of clinics set up for J&J, you know, for restaurant workers, et cetera. And we have to pause and kind of pivot or see where we go with this. So they're obviously going to be the main ones to guide all this because, I don't know anything about when we're going to get doses, et cetera. But I think everyone's hope is that it really is a pause and we're going to be able to move forward. But it's just kind of wait to see what they say. But it seems like there's again, at the end of this talk, you're going to see the links for a vaccine. It's amazing how many places really have popped up, even in the past week, that there's just so many doses of vaccine out there and everybody just has to, constantly log on and get an appointment. A lot of places do take walk-ins, so it just depends. And I think this is just kind of a pause, but the positive is there is a lot of vaccine clinics out there. For example, Northwest Indiana, I know it's been in the news, but Gary, FEMA is currently in Gary and they've set up shop there. It's 10 hours a day, 7 days a week. They're giving Pfizer. There is a ton of appointments. Like you technically can log in right now and get an appointment for today, for tomorrow. I wouldn't be surprised. And there is no residency requirement because it is FEMA and because of colleges, they did say we want to vaccinate our college kids. We don't want to be stressing out about where do you live, et cetera, et cetera. So it's open to everybody. So if you have transportation, you're able to go, I strongly recommend it. There have been a lot of people from Illinois, a lot of kids from my child's high school traveling over there, and it's fine. It's legitimate. I mean, Indiana welcomes you. It's just another source of information. So definitely, we just have to keep looking at where else the vaccine is. We shouldn't just kind of wait and be like, okay, well, when's the next J&J clinic popping up? So.
Thank you. I see they put your link in the chat box as well.
Okay.
Sorry, Paul, go ahead.
No, that's what I was going to say, Terry. Doctor, if you just want to go through and talk about the links that you had referenced earlier.
Yeah, so I don't know if I can see it, but this is an amazing document that basically is it helps you navigate the entire process. Like it tells you how to land an appointment at United Center. It tells you it's updated every single day. So we strongly recommend every day log in at 7 a.m. because new stuff will be posted. Even last week, Grundy County all of a sudden had a ton of Pfizer vaccine. So it was we'll vaccinate 16 and up. And this is before Illinois said officially you can vaccinate 16 and up. But they had a ton of Pfizer vaccine. So of course, they're not going to let it go to waste. So they posted, we'll take 16 and up. If you live in Illinois, they had 300 appointments. By the end of the day, all the appointments were gone. They were taken. So it's just an excellent source of information to log into that link.
And how do we get to the link, Doctor? What is the link?
It's in the chat. I think, yeah.
We put it, that's in the chat box. And we just put another one, South Suburban College, which is right here in South Holland, now vaccinating 1,200 people per day. And so there's a link for that as well. Patrick Rush shared that one, so that's in the link. I do have one additional question as well here. This is from Christine to Jim. Have many of the hesitant employees received the vaccine after your initial push? And follow up to that is, are employers allowed to track whether or not staff is vaccinated in the interest of overall safety?
Well, I'm not sure about the second part of the question, but the first part of the question is, I think we've had one person reconsider and get their vaccine, but the other 20, 25 people are holding out. And so what was the other part of that, the second part of that question again?
The second part.
Dr. Rosales will answer.
Oh, you answer it.
Okay.
Yeah. So basically, I think it is important to see who's been vaccinated, because that makes a huge difference on who has to quarantine and who doesn't. Yeah. You still have to know if an employee is going to take vacation and fly to Florida fly to Arizona, depending on what the numbers are at that point. If you're not vaccinated, you have to come back and quarantine. You have to get tested. I mean, there's a whole set of rules for you because you're not vaccinated. If you're vaccinated, you could travel anywhere in the US. It doesn't matter. You can come back to work the next day. So that's a huge reason that I think it is important to know who's vaccinated, who's not. And specifically for me, I'm a tiny office. One of my medical assistants isn't vaccinated. I had to specifically pull her aside and say, you know, you're not vaccinated. And I had explained the whole quarantine process. So it's like, I'm not sick, you know, it's just CDC guidelines. So if everybody else goes on vacation, they can show up to work tomorrow. If you go on vacation and you're still unvaccinated, then you do have to quarantine. We do have to test you, et cetera, et cetera. So, and all those guidelines are going to keep changing, obviously, as the numbers change. I don't think they have guidelines yet for international travel, but I would imagine it's the same thing. If you're not vaccinated, you're definitely going to have to test, quarantine before you can come back to work, waiting to see if you do develop symptoms compared to somebody who's vaccinated. So.
I will answer that we have kept meticulous records from the beginning of COVID on who has been working on what shift, on what production line. Because when we have had positive cases, we've had to send people for testing or have them stay home for quarantining. And obviously we have a record of the people that got vaccinated and who have not. So that has made things a lot more manageable if we end up with a positive case, which fortunately for like the last almost 30 days now, we've had no positive cases.
Thank you. And Terry, I think you mentioned the information from South Suburban College as well. That is a mass vaccination site in South Holland. Information available at vaccine.cookcountyillinois.gov. It's one question I had, Terry, for you is, can the chamber post these links on our website for folks after the webinar and provide a little bit of visibility to make sure people know where to go for the information?
Sure. We actually have a COVID resource on our website, so we can post them there so anyone can see it. But additionally, those that attended today, I had put in the chat box for them to let us know. But I'm sure that Sherry, which is on my list to thank her next. So I'll thank Sherry right now for all she does behind the scenes. She manages all the details of all this. And she would be happy to send it out to all the attendees. She'd already texted me and said, let's make sure that people get these resources. So all fabulous resources. Thank you all so much. It's very, very good. I'm going to before I give a couple of announcements for upcoming events, I want to point out that in the chat box, the last one that was just put in is a survey. And so we would really appreciate if the attendees would go in and get that link to that survey so that we can gather some information from you. So please do that. And I want to thank all of the committee members. And Randy, thank you for that plug that you said that the chamber members, it's a benefit that they get to have something. We have lots of benefits for chamber members, and those that are not chamber members, we encourage you, and you could please reach out to me at any time and I could answer any questions for you. We have lots of great events. Monthly, we have a government affairs panel, which yesterday we just had President Toni Preckwinkle from the Cook County board, and she gave a fabulous presentation. And obviously today you're seeing the results of a fabulous panel for our healthcare committee. And next week on Wednesday, April 21st, we have an education panel, and this month it is focused on IT. So we have Jay Barriga, who's the IT manager at Prairie State College, and he's going to talk about different apps and different devices, what's good for, and this is good for small business, large business, just individuals. And then Erica Bell, who's the president and CEO of the Virtual Office, she's going to talk about e-commerce on your website. And then Jorge Norick, who is a Google trusted photographer, is going to talk about how to optimize your business using Google. And then we also have a monthly meet and greet. I would encourage any of you to attend. The monthly meet and greet is open to guests and members, and it's an opportunity to we'll have one featured speaker, but the rest of the time you're in different breakout rooms, and it's a true opportunity to do some networking and not really handing business cards these days, but we can certainly share information differently. So it's good for all of you to get involved in the chamber. We appreciate all that. Paul, any last minute words?
No, it's just thank you, panelists. Maybe just go to each of you for maybe just some quick closing remarks, but just a terrific job. Jim, any closing remarks, or Randy, Dr. Rosales?
It was very interesting for me to hear some of the information that I didn't know about. So thank you. And all these links for these vaccination sites, I think will be very useful.
Thank you, Jim. Randy?
Just keep at it. We just got to keep doing what we're doing to make, myself safe, you safe, your family safe, and the communities that we deal with safe. Just keep doing what we're doing. And, teamwork makes the dream work, right? That's kind of a saying, and let's just keep it up.
Thank you, Randy. Dr. Rosales?
Yes, just want to say, obviously, thank you for having me. Everybody, please get vaccinated, keep wearing your mask, keep washing your hands, and keep distancing. That's our only way out of this pandemic.
And before I close, just want to thank our committee. We have a fabulous committee. Thank you, everybody, for your help in supporting this webinar. Terry, to wrap it up.
Okay. I want to thank you all again, and special thanks again to Sherry Hensley helping us make this, and for our entire healthcare council for their work on making this a success. Everyone have a great day. Thank you.